The world will always need knowledge, different sorts of knowledge, and this is what teachers are meant to nurture.
Teachers prepare learners to be ready for extraordinary times, such as this, to have foresight and tools and strength and courage to be useful and withstand times such as this and its aftermath.
Hi everyone, my name is Jennavive Pereira. I'm one of the rotating clinical psychologists that works with CK, and this is my colleague Rozelle van Wyk, who is also a clinical psychologist and works alongside me at CK.
Hi. We've been asked to share with you information around trauma, and we feel that it's such a relevant topic at the moment given the COVID-19 pandemic in which we find ourselves, and we're really hoping that you'll find what we share with you informative but more so supportive in a time of uncertainty and confusion as well. So we really hope that you'll benefit from this presentation. What we've done is we've split it in two parts. So the first part will cover trauma theory, and the second part is more practical techniques that can be implemented within the school's environment and also within your classroom setting. And now for some trauma theory. When a person experiences a traumatic event, he or she becomes an injured person that suffers from what we call emotional wounds. Over time, even without professional treatment, the symptoms of an emotional trauma generally diminish and normal functioning gradually returns. However, sometimes the condition and consequences of the aftermath do not subside. Professional assistance may then be required when a person's daily life functioning or life choices continue to be affected by the traumatic event. Psychological distress following exposure to a traumatic or stressful event is quite variable. In some cases, symptoms can be understood within an anxiety or fear-based context, whereas in others, the most prominent clinical characteristics are, firstly, anhedonic and dysphoric symptoms. These are an inability to feel pleasure and a continued feeling of unhappiness or distress. Secondly, externalizing angry and aggressive symptoms. And thirdly, dissociative symptoms, which are feelings of disconnectedness or detachment. This heterogeneous clinical picture is also in close relationship to the following diagnoses and disorders: anxiety disorders, obsessive compulsive and other related disorders, as well as dissociative disorders. Because of these variable expressions of clinical distress following exposure to a traumatic or stressful event, a separate category grouped the following disorders together as trauma and stressor-related disorders: reactive attachment disorder, disinhibited social engagement disorder, our well-known post-traumatic stress disorder, acute stress disorder, and adjustment disorder, in which exposure to a traumatic or stressful event is listed explicitly as a diagnostic criterion. It's important to note that the expression of trauma includes a full spectrum between internalizing the expression, or the experience rather, with depressive symptoms and also withdrawn behavior. And on the other end of the spectrum, having externalizing the experience with aggressive symptoms and marked disinhibition, either lack of restraint and or self-control and impulsivity. It's important to differentiate between traumatic stress, post-traumatic stress disorder, and secondary trauma. Traumatic stress is a time-based event, and it does not differ in the severity of the event or trauma, but the severity and the length of symptoms, which are described as short-term, and they do not meet the clinical definition of post-traumatic stress disorder. These symptoms are also said to gradually improve over time. With post-traumatic stress disorder, it's a longer-term condition where the severity and the length of symptoms are said to be ongoing and chronic. These symptoms are diagnosable when they persist for more than a month, and it's often described that as that your nervous system remains in shock. Please note that while the symptoms of traumatic stress and post-traumatic stress disorder look very similar immediately following a disaster or disturbing event, they progress very differently. When these symptoms become an ongoing feature and last for more than a few weeks, it usually becomes problematic to being able to function optimally as one would before the event. Secondary trauma is very different. This is an emotional duress that results when an individual hears about the first-hand experience of another. We also call this vicarious trauma. Therapists such as psychologists, registered counselors, social workers, child welfare workers, case managers, other helping professionals, educators, we are all at risk for this. The essential act of listening to trauma stories may take an emotional toll that compromises professional functioning and diminishes quality of life. It's important to be aware of this indirect trauma exposure, as it is a basic part of protecting the health of the worker and ensuring that children consistently receive the best possible care from those who are committed to helping them. Secondary trauma has been recognized as a common occupational hazard for professionals working with traumatized children. It's also referred to as compassion fatigue, and it's important to note that this is not a reflection of either weakness or incompetence. It's rather just the cost of caring. Different types of trauma. Here's a list of situations that are described as traumatic. Natural disasters, early childhood trauma, sexual abuse, physical attack with or without a weapon, bullying, domestic violence, medical injury, illness or procedures, community violence, terrorism and violence, also gang-related activities, neglect, deprivation, car accident, and traumatic grief. There are three main types of trauma: acute, chronic, and complex. Acute trauma results from a single incident, and this is also known and classified as a type 1 trauma. Chronic and complex are classified as your type 2 traumas, where chronic trauma is described as repeated and prolonged trauma, but it's a specific trauma, whereas complex trauma is exposure to varied and multiple traumatic events, often of an invasive, interpersonal nature. They're wide-ranging and also have long-term effects. I think all of us are familiar with the fight or flight response. So with Shower and Albert, they've given actually a freeze, flight, fight, fright, flag, faint response. And this is where our sympathetic nervous system sort of gets stuck. I realize this might be a lot of information, so what I thought might be helpful is to give the trauma examples and give specific examples under the different headings. Type 1 being your acute and single incident trauma, and your type 2 being chronic and complex prolonged traumas. As you can see, under your acute, traumas can be childbirth, abandonment, severe illness or injury, hospitalization, medical trauma, road accident, violent assault, sexual assault, traumatic loss, post-suicide attempt, mugging or robbery, victim of violence, witness to violence, psychiatric hospitalization, witnessing a terrorist attack, witnessing a natural disaster. And then under type 2, chronic and complex prolonged traumas, this would be your neglect, such as malnutrition, lack of affection and or attention, abuse, emotional, physical, as well as sexual, medical trauma, your critical accident or cancer, community trauma such as your gun violence, gangsterism and bullying, and then as well your disaster events. Now I'll be handing over to my colleague Jen, and she'll talk to you about the signs and symptoms of traumatic stress.
Thank you, Rozelle, for that introduction. As my colleague said, my name is Jennavive Pereira, and I'm also one of the rotating clinical psychologists at Community Keepers. And I'm briefly going to go through just some signs and symptoms of traumatic stress, as well as the emotional impact it has on children and some practical techniques for educators and learners. So I'm going to quickly go through just some signs and symptoms of traumatic stress. So traumatic events may or may not directly impact an individual. It's very normal to feel anxious, scared, and uncertain about the future and what it may bring. So usually what happens with traumatic stress is that the nervous system becomes overwhelmed by stress triggers, and a wide range of intense emotions and physical reactions may occur. And this ranges from mild to severe, and it often comes in waves. So for example, you may at times feel on edge, sometimes jumpy, and other times numb or just disconnected from your environment. So I'm going to quickly go through some of the emotional symptoms of traumatic stress. So one of the symptoms you need to look out for is shock and disbelief. This is when there's a difficult time accepting the reality of the event. You may feel numb or disconnected from your emotions. Fear is another emotion that is very dominant in a traumatic stress environment. And this manifests as worry that something will happen again, or that you will lose control or have a breakdown. Sadness and grief is also something that needs to be looked for, particularly if the people that you are dealing with or the children that are in your environment have experienced a direct death from the traumatic event or the traumatic stress, or that they know someone that has suffered life-changing consequences due to the traumatic stress or the event. Anger is also something that is seen very often, particularly with children, and you will notice that sometimes some people may become angry at their deity, their governments, or other entities that they may feel are responsible. So for example, currently the world at the moment is very angry at China due to the whole COVID-19 pandemic. Helplessness is also something that often comes up as a feeling where there is a sudden and unpredictable nature of accidents, pandemics, natural disasters, or violent crime, which can leave the individual or people feeling very vulnerable and helpless. And this triggers a combination of anxiety or depression, or either one. Shame is often seen as well in terms of feelings or fears that one cannot control, as well as guilt, where the person or people may feel that they have survived or others did not, or there's a feeling that they could have done more to assist. And then lastly, relief. Relief that the worst is over, that the person or the individual was not as badly affected as others, or hopeful that life will return to normal. All of these emotions are usually seen in a combination, and this can cause a lot of uncertainty and that roller coaster feeling. I'm now going to introduce the physical symptoms of traumatic stress. Most people will sometimes feel a sense of dizziness or feeling faint, stomach churning, some gastrointestinal tract symptoms, and possibly excessive sweating. You will sometimes maybe notice as well that there is a shortness of breath, rapid breathing, a pounding heart. Some people experience chest pains, and all of these can be confused with our COVID-19 pandemic at the moment, which can cause even more anxiety and traumatic stress. Some people will also show signs of trembling, shaking, cold sweats, a feeling of a lump in the throat, or just feeling choked up in general. There will also be occurrences of racing thoughts, where there is difficulty with concentration, there may be some confusion, some memory problems, restlessness, or pacing with the racing thoughts. So you will maybe notice children particularly are very fidgety, playing with their fingers, their legs are shaking the whole time, and that's something to look out for. There may also be changes in sleep patterns. So for example, there may be a lot of insomnia, nightmares, and vivid dreams. At the moment, there's a lot of research going into the COVID-19 and how it is manifesting in people's dreams. There might also be a loss or an increase in appetite or excessive consumption of nicotine, drugs, or alcohol, and this can be particularly predominant in our learners. I'm now going to briefly talk about the factors that influence the emotional impact on children in emergencies and crisis situations. The emotional impact of an emergency on the child depends on the child, their experiences, their social and economic circumstances of their families and their communities, as well as the availability of local resources within their communities. Not all children may respond in the same way. There may be some severe, long-lasting reactions as well. Specific factors are also very important when it comes to the impact of traumatic stress on children in emergencies, and that is the involvement with the emergency, whether it was a direct or an indirect involvement. There may have also been a previous traumatic or stressful event, which then triggers the child again. There may also be a potential for separation for caregivers, especially in the COVID-19 situation. We know that if someone is sick, they are quarantined in hospital for a number of days or even weeks, and they are not allowed to have any visitation from their families, etc. And this can be very impactful and very traumatic for children specifically, and any physical injury as well. Loss of a family member or a close friend or a pet, or a belief that the child or a loved one may die, which is something that is very frequent with the COVID-19 pandemic. You need to also take into account the family resources that are available for the child, their caregivers or the parents' response to the pandemic, relationships and communication between the family members. So is there a lot of conflict, arguments that's occurring in the household due to the current situation or the environment that the family and the children find themselves in? Repeated exposure to mass media coverage of the emergency or the event and the aftermath thereof. And we know that at the moment, our news channels are inundated with COVID-19 statistics and occurrences. Something that's very important to take into consideration are the cultural differences. Each culture does tend to react to traumatic stress in a different manner. Community resilience and ongoing stress due to changes in the familiar routines and living conditions. So for example, in this context, a lot of families have lost their jobs due to the pandemic, and this can cause a lot of stress and anxiety within the family context. I'm quickly going to go through some common reactions in the different age groups of children. Common reactions to stress or distress will fade over time for the majority of children. The direct exposure to the disaster can lead to the child becoming upset again, and the behavior related to the event may return. So for example, dreams or nightmares if the child sees or hears reminders of the event. Continuation of these behaviors result in poor school performance, or relationships with parents may become very conflictual and irritable. And this is where it becomes very important to seek professional help. In terms of your pre and your primary school reactions, I'm going to go slowly through the different age groups. So infants to 2-year-olds, they may present as cranky, they may cry more than usual or want to be held and cuddled more frequently. Your 3 to 6-year-old age group, these are your preschoolers. They may return to behaviors that they've outgrown. So for example, bedwetting, separation anxiety, and this is something to look out for, particularly when parents drop off their children at school. You may also notice tantrums or difficulty sleeping. 7 to 10-year-old age groups, so older children tend to present a little bit differently from your younger. So they may feel very angry, sad, or afraid that the event will reoccur. So for instance, that they may catch COVID-19 while being at school, or that their parents will catch it at work and bring it home and everyone will get sick. Peers may share false information. And this is the perfect opportunity for parents and educators to correct this information. As we know, misinformation or fake news can result in a lot more anxiety than is necessary. Older children may focus on the details of the event and may want to discuss it all the time, but you may also get older children that do not want to discuss it at all. You may also notice attention and concentration difficulties. With regards to your senior primary and high schoolers, so your preteen and your teenage age group, this age group may respond to trauma by acting out. There may be reckless behavior, such as reckless driving, alcohol, and/or substance use. In some cases, they may be afraid to leave their homes and may isolate from friends. They often can become very overwhelmed by their emotions, and they may feel unable to talk about them. And these emotions can lead to increased arguing, fighting with siblings, parents, or even their educators or other adults. My colleague and I decided that it is important for us to go through how to deal with traumatic stress, especially for educators and learners during the COVID-19 pandemic. So COVID-19, as we know, has been classified as a pandemic. So what is a pandemic? It is a disease. It is prevalent over a whole country or the world. It is widespread, prevalent, pervasive, rife, and rampant. Our current COVID-19 pandemic has been classified as a natural disaster, not only causing death and economic crisis, but also having a significant effect on the mental health of its survivors, which includes all of us. Crisis management efforts are often directed at providing and supplying basic needs of the individuals. For example, food, which is an essential service. However, particular attention should also be paid to the psychosocial impact of all the victims, and that is why we are all here today. Remember, and I cannot emphasize this enough, it takes time to recover your emotional equilibrium and to rebuild our lives. Specific techniques to help yourself and colleagues, children, etc. to help with the aftermath of the trauma are extremely important. There is no right or wrong way to feel. People react differently to trauma. Avoid telling yourself or someone else what to think or do. Do not ignore the emotions. This will only slow down your recovery. At times, it may be easier to ignore or avoid experiencing the emotions, but they will not disappear. This might be in a situation where you need to push aside those emotions in whatever context you find yourself in, but it's important to note that you will need to come back and address those emotions. Intense feelings will eventually pass if you allow yourself or others to feel your emotions or their emotions. Something that's very important to do is to avoid obsessively reliving the traumatic event. Repetitive thinking or viewing of images over and over can overwhelm the nervous system. Use distraction techniques that can keep your mind occupied. So for example, things like reading, watching TV, doing a hobby that you enjoy, maybe going for a run, etc. Exercise is very important. Yoga or mindful meditation are good ways to cope and to refocus the mind away from the pandemic and the current situation we find ourselves in. These will help to redirect your energy and attention away. Re-establish your routine. Familiarity is extremely important and comforting. It makes you feel like you are in control. Put major life decisions on hold. These major life decisions may increase stress in your life. It's important to try to regain your emotional balance first. So for example, in terms of our schooling system at the moment, many parents are afraid to send their children to school due to the pandemic. It is important to weigh the pros and the cons for each situation and then make a decision before making an impulsive decision, which may then have negative consequences on the children and their learning for the rest of the year. I'm now going to go through some practical techniques that will help learners cope with the pandemic. In terms of your preschoolers, focus on communicating good health behaviors. Encourage regular hand washing for 20 seconds. Make use of sing-alongs to make the learning fun. Develop a way to track how children are washing their hands and develop reward systems. This could be a sticker reward system. Make use of puppets or dolls to demonstrate symptoms, or what to do if children feel ill and how to comfort someone who is ill. During group work or carpet time, Children should sit apart from one another by practicing stretching out their arms, almost as if they are helicopters and they cannot sit in that personal space. With regards to your primary school, it's important for you as an educator to listen to the children's concerns and answer questions in an age-appropriate manner. Avoid overwhelming them with too much information, so this might include statistics. Encourage expression and communication of feelings. Discuss the different feelings and normalize reactions to the situation. Emphasize that the children can do a lot to keep themselves and others safe. Empowerment is crucial at this time. Focus on good health behaviors, as I previously discussed, the coughing into the elbow, the sneezing into a tissue, washing your hands for 20 seconds, and so forth. Help children understand the basic concepts of disease prevention and control. Utilize exercises that demonstrate germ spread. There are a couple of videos on YouTube that will help you with this and how to explain this to children. Demonstrate the importance of washing your hands for 20 seconds multiple times a day, and have learners analyze texts to identify high-risk behaviors and suggest ways to change them. So it needs to be a very collaborative process with the educator as well as the learners. With regards to your high school learners, listen once again to the learner's concern and answer their questions. I cannot emphasize learner empowerment enough, especially with our older learners. Remind learners that they can share healthy behaviors with their family, so they can take the education that they learn at school and give it to their family members to help them stay safe. Encourage learners to confront and prevent stigma. At the moment, there is a lot of stigma coming up due to the pandemic, so it's important to highlight the stigma and to combat that. Incorporate relevant health education into other subjects. So for example, in science, you can cover the study of viruses, disease transmission, and the importance of vaccination. Have learners make public service announcements through school announcements and perhaps posters. So one of the most important points was the role of the educator, and this can sometimes get confused for educators. So the educators stated in the article that they struggle with their role, and they often wonder at what point their tasks as an educator end and at what point those of a social worker or psychologist begin. Some educators stated that they felt that there is a trend to becoming a caregiver, while others prefer sticking to academic skills. There was a request that tasks should be divided and described more clearly in order to have every professional stick to their specific expertise. Therefore, boundaries in education are very vague. Another point that was made was finding balance in answering the different needs of the learners as well as the educators. A child's needs versus the group's needs. It was difficult to support a child confronted with a severe stressor and managing the class simultaneously. So this is what one of the educators stated in the article, that it was very hard to give attention to one individual learner while trying to manage 20 or 30 other learners within the classroom. Acting out and withdrawn behavior requires extra effort and attention to involve the child in the lessons. And this takes away from the other learners in the class, and it might also make the other learners want to react in that way as well in order to get the individual attention from the educator. And this was a very jarring role that the educator had to find themselves in. Point 2 that came up in the article was the focus on trauma versus the focus on normal life. The educators felt that there needs to be a good trade-off between caring for the child and preventing attention giving from becoming too heavy within the classroom. There was a need to not focus only on the traumatic experience, but also to focus on other aspects of the child. Many felt that life should go on, so not to just skate over the event, but to not overly focus on what happened, but also encourage the positive side of what the child is accomplishing post-event. The third point was giving extra attention versus creating an outcast position. Educators often struggled with wanting to be there for the child, but not placing the child in a special position that would make him or her an outcast, or interfere with the general rules of the classroom. And this was something that they severely struggled with within the article, was how to manage these two needs. Another point was a need for professional knowledge and know-how. The majority of educators expressed feeling a lack of competence regarding how they should act when a child has been exposed to trauma. Doubts around emotionally processing, normalizing, and incidentally providing distraction. They were also unaware of any protocols or guidelines within their school that would help them assist learners who have gone through a traumatic event. Trauma-focused courses and more information materials about trauma recovery were salient points that the educators made. One of the questions that they asked was how to talk about the traumatic event. So it is important to create a safe atmosphere in the classroom to discuss the emotions. So for example, the movie Inside Out is a very good movie to show children how emotions work within the body in a very fun Disney/Pixar Studios way. Further into the presentation, my colleague Rozelle will be going through some do's and don'ts, but she did mention at the moment that sitting and listening is one of the most important skills to use, as well as not giving any solutions, and attending to the learner with unconditional positive regard, which is a very Rogerian way of interacting with the learner. So an example of how you can do this is by saying, I can see what you are going through is difficult. I am proud of you for coming to me. Maybe we can get someone who you feel comfortable to talk to. And also to perhaps do some weekly check-ins with the learners. One of the other questions that the educators had was, when is specialized care necessary? So there was some uncertainty around which stress reactions are part of normal recovery trajectories, with duration of symptoms and behavior problems is normal, and in which cases additional care, for example, having a social worker or a psychologist involved, would be necessary. And this is what we talked about in slide 3, about the traumatic stress, as well as slide 5, the signs and symptoms of traumatic stress. Those will be your guidelines in how to distinguish when a professional is needed. Where to refer is also very important. There needs to be some knowledge in terms of where to refer the learner. So very important that children show what is going on through their behavior, and that is something you as an educator need to look out for, and then you need to map out the available resources within the community in order to refer the child to the appropriate professionals for assistance. There was also a point about the emotional burden of working with traumatized children. There was a challenge to find a balance between being committed to the well-being of the child versus being too emotionally involved. And Rozelle earlier spoke about compassion fatigue, and this is where that topic would fall into. So one of the points was taking the problems home. This was one of the most demanding aspects of an educator's work. Traumatic exposure and traumatic stress among their learners was something that they tended to take home and experience at home. Experience with traumatic stress helps with this. Young educators may feel strong emotional responses to seeing and experiencing their learners suffering, and experience improves way of managing feelings over time. So we all come down to, once again, having just a brief understanding of how to hear what the child is saying, where they are coming from, containing them within those boundaries, and then referring on to the professional. An important source for the emotional burden is that there's a sense of helplessness that the educators may feel because they are unable to help, and there may be limited contact with parents or legal guardians, or just a lack of knowledge or skills. And this resulted in them taking the problem home. So it's important to also debrief with perhaps colleagues or the principals at school to help manage that compassion fatigue. One of the other points was the earlier personal experiences. So their own history of trauma as an emotional experience can sometimes be triggered by the children and what they are bringing to the educator. It impacts the educator's own level of functioning and emotional availability to the child. This is where it becomes very important to have classroom materials for children to utilize. And then support by colleagues, as I mentioned earlier. Any doubts or questions relating to the optimal support for children is normal. Supportive, open atmosphere within the team of educators regularly is mentioned as helpful. So it's important to do those check-ins with your colleagues and with your superiors. It's important to ask for advice, keeping in mind to safeguard the confidentiality of the learner. And this will ensures trust between the learner and the educator, even though you need to perhaps do your own debriefing with your colleagues. I'm now going to pass over the rest of the presentation to my colleague Rozelle, and she's going to go through some do's and don'ts.
Thank you, Jen. I think I speak on behalf of both of us where we really wish that this is the part of the presentation where we would have really liked more interaction. So we hope that you're bearing with us with regards to all the information that we're throwing your way. I'm going to do the do's and don'ts, and it's a short list for you specifically in terms of what you can do as opposed to maybe not doing something else. Firstly, as Jen has shared with regards to not just the article but just in general, to show care by noticing changes in behavior is of utmost importance. We can do this by just recognizing what the learners are going through, by saying, you do not seem like yourself today. Is there something going on? The don't of that would be, do not push for information or ask pointed questions to the learners. Secondly, lend an ear and give a casual invitation for the learner to share with you whatever it may be that they're going through. You can do that by saying, would you like to talk? It's important to not ignore concerns or minimize what has happened for the individual learners. Thirdly, let the learners know that adults are here to keep them safe, but do not tell them that everything will be okay or that everything will be the same. Fourthly, do more listening than talking. I think it's important to caution away from dominating the conversation and rather just give that casual invitation for the learner just to share with you how they're feeling and what's happening for them. Fifthly, provide opportunities for learners to express their feelings and encouraging them also to talk to trained mental health professionals. If there's a community keeper's office at your school or a school psychologist, encourage them to seek the help from the office or the psychologist and talk to them. Do not share prescriptive ideas, either encouraging them to buy over-the-counter medication. Number 6, remain calm in referring to and discussing the event. Do not recount explicit traumatizing details of the events for the learner. 7, keep to routines as much as possible. We almost can't emphasize this enough because consistency is a way of creating safety, it's a way of creating security for the learners in a time where everything is uncertain and there's a sense of, well, a potential sense of helplessness or hopelessness. So keeping a routine, keeping the consistency is very important. Do not describe the event as a catastrophe or a disaster. I know we've made mention of the word disaster, but I think specifically with learners it adds to their sense of feeling helpless and hopeless and not believing that they can overcome whatever's happening for them. And lastly, remember that all learners have the right to confidentiality. So when engaging with them in these difficult conversations, just keep that in mind. And when you speak to colleagues and gain support from them, maybe it would be important to not mention or name the learner specifically, but just talk vaguely around what you've been exposed to. It's important to not get involved in a therapeutic relationship, and I think that speaks to one of the points that Jen covered, to still remain within your educator role, but caring and inviting difficult conversations for learners specifically in this time. But when you see that there is concern, to then refer appropriately. I think this point is important because it safeguards both you as the educator with regards to the compassion fatigue or secondary trauma that we spoke about, as well as giving the learner and providing them with the necessary assistance. This take note is a special slide, and it's a slide specifically for you as an educator. I think in a time such as COVID-19 and what's happening currently in the world, there are exacerbated feelings of guilt with regards to, are we doing enough? Shouldn't we be doing more? So I think it's important to firstly be realistic about the external limitations on what we can do right now. It's not our responsibility to take on for all the changes that are currently happening. And there are very real limitations on who we can reach at this point in time. We also need to, unfortunately, and I think this is a difficult one, accept what we cannot control. Secondly, this is almost just as important as the first one, be kind to yourselves. I think it's important that we balance what we can do with what we can't do. And through being gentle and kind to ourselves, and also being realistic with regards to ourselves and our unique situations, self-care becomes very important. We're also allowed to be struggling at this time, and I think that being within any helping profession or a profession where you're reaching out to learners and trying to support them and be there for them, we often forget that we too are also only human, and we may be struggling at the same time. Thirdly, be focused and direct energy towards what we are able to do. We believe that closer awareness brings understanding and realizations that we are doing something. Even though that this may not look exactly the same as our job description previously, we are doing something that's still important. So maybe focus on priorities. Priorities such as taking care of yourself, taking care of your family, taking care of your immediate community, taking care of your school, taking care of your learners, obviously taking care of colleagues as well. And yeah, it's just reiterating that self-care is important. Fourthly, be creative. I think this is a time where we can really all be creative in terms of how to connect with either colleagues or learners or other allied health professionals, and to utilize this time to brainstorm about different ways of being helpful to specifically our school communities. I think the big question is, how can we help them feel connected and supported during a significant time of disconnect and uncertainty? And then lastly, be mindful. I think I'd like to encourage you to take a moment to acknowledge, whether it's either in writing or just in thought, of what it is that you are doing at this point in time, and to acknowledge that and to recognize that you are doing something. I think it's worth mentioning that this interim period between what Jen described as the signs and symptoms of traumatic stress response and the referral process that I'm going to touch on now is crucial. And I honestly believe that educators are at the forefront when it comes to knowing the learners in their class. Through interacting with them, yes, within more an academic context, but I think also on a daily basis and in an interrelational manner. I think educators are thus primed for their role in being able to recognize the differences that we've spoken about, differences in whether it be behavior, whether it be mood, any difference that is identified with the learner is indicative of their functioning, whether it's optimal functioning or not. And in this regard, it would be not. Training design should be directed toward the individuals who are available to engage in service delivery. And this is important because it's also supportive for the educators that are stepping into this role within the bigger system. We need to look at appropriate trauma provider care, specifically for the principals, for educators, for mental health workers, etc. It's important to note that trauma training may do more harm if poorly implemented, and I think it's important that risks, pitfalls, and even potential dangers need to be included in the curricula. Consideration of ethics, self-care, interprofessional conduct, and risk management need to be integrated into the teaching of all substantive areas. An integrative approach is required across disciplines at the moment and sectors for specifically trauma-exposed populations. Here's the question: when is it necessary to seek professional treatment? Educators and learners going through adverse experiences may comfort in the consistency, as I said earlier on. Consistency of school, of work, routine, schedules, and obviously also the familiarity of being back to school. Within this secure framework, educators are able to create a safe space and the honest conversation with their learners, whereby they may express concern, or alternatively the learner may feel comfortable to reach out and ask for help. As Jen mentioned, empowering learners is important to regain a sense of control or autonomy, independence, as well as hope. Referrals are considered specifically when the signs and symptoms do not normalize and behavior persists for an extended period of time. When there's also significant concern that the different areas of functioning have also been impacted. So the changed behavior is not only seen within the school context, but it's also seen at home and in other areas of functioning. We're going to have a look at the referral process in more detail. What does the referral process specifically entail? I think it's important to firstly follow the reporting procedure of your respective schools. Refer to the school or district policies regarding crisis intervention and or management. Secondly, I think it's important to work with a caregiver or legal guardian of the child to share and address possible school problems that may have arisen. It's important to identify the basic needs, also creating rapport with not only the learner but also their immediate environment, which involves their caregivers. Allow learners to narrate their stories and or their experiences and evaluate the factors that could put learners at risk. I think it's important to share these concerns and the risk factors that have been identified with the caregiver or legal guardian, I think is also important. And then to refer to community resources when a child shows signs of being unable to cope with traumatic stress. Make the corresponding referrals by contacting school counselors, psychologists, social workers, and other mental health or relevant personnel. For instance, even a school's general practitioner or doctor would be helpful. We've included a few emergency numbers here, which are these are the emergency numbers that we as community keepers share with the educators and learners as well, who we have contact with. I think maybe just on this slide, maybe just to add that there are organizations that can also facilitate with the referral process, and it would be important for you to research and have a look at what are the immediate organizations in your area or in your community. Organizations that are coming to mind are sort of just Jelly Beans or FAMSA, Childline. I think it's important to locate those and know where they are and what their details are, so that when you need to refer, you have almost like an emergency list at hand. And then lastly, our conclusion. I think with all that Jen and I have shared with you today, just within the context of trauma and within the context of this COVID-19 pandemic, I think a key factor that I wouldn't like us to overlook is that each of us have resilience within us. And there's a quote here that we felt that we would like to share with you and also end the presentation with, and it says, building resilience in children is not about making them tough. Resilience is the ability to recover from difficulties by managing how you feel. And I think it's important for us just to take a moment to reflect on our children are resilient, our children are strong, and this quote by Rhea Pullman says, children have powerful spirits. And I think to just recognize that, I think, is also important. Here's just a list of the references that Jen and I used for this presentation. We encourage you to look it up, read if you have time. We do realize that this is such a balancing act with regards to going back to school and catching up the academic work that has been lost in this time, and also then being emotionally present and available for your learners. But if you do have the time, we do encourage you to read some of these articles. And with that, I'd like to say thank you so much for your time. Thank you for your patience. We realize that this has been a long presentation. We know there's a lot of information that we shared. And just to reiterate what I said in the beginning, we really hope that some of this you can take and you can use, and that it will support you in this time. We are thinking of you, and we're extending support to you in this time. Thank you.